I will begin and end my presentation by asking each of us to take a moment to think of the deadly impact of the actions of the State of Israel on health workers in Palestine. Each day that Israel is allowed to continue bombing, to continue the genocide of the people of Gaza, more health workers die. To date, we've seen over 400 health workers killed. And we know that the health situation on the ground is devastating, with people unable to access essential medicines, lack of anesthetics and supplies for surgeries, and decimation of health infrastructure. We have seen, literally live streamed, the targeting of health facilities, as we just saw with Nasser Hospital, direct bombing of ambulances, and the invasion of hospitals, which are both caring for the wounded and also sheltering people seeking refuge. Meanwhile, here, we've seen an intense silencing of Palestine solidarity within the healthcare community, and the previous speaker, I think, gave a very important example of that. This has included some very high-profile instances covered in the media, such as that of Dr. Ben Thompson, a nephrologist who was suspended by his hospital for posting in support of Palestinian human rights, or the case of Dr. Yipeng Ji, a resident trainee in Ottawa who was also suspended. Both have been reinstated, and in both instances, unfounded allegations of anti-Semitism were made. But outside of these high-profile instances, there have been many others that have not reached the media. We have seen a pervasive pattern in our medical institutions, both within academic health sites and in the community, of health providers being called into the office, receiving complaints, or experiencing harassment. What we're seeing is a dangerous conflation of critique of the state of Israel with anti-Semitism. Allegations of anti-Semitism have been made for example, signing a petition, mentioning Gaza in land acknowledgements and drawing parallels to the genocide of Indigenous peoples in Canada, sharing social media posts, using words such as genocide, apartheid, or settler colonialism to describe the actions of the state of Israel, or even calling for a ceasefire. And what has been notable in almost all of these instances is the rapidity with which institutions will move to suspend or to use their full weight to investigate and punish. We've seen both a misuse of bureaucratic process to silence, as well as instances of complete lack of due process. In November 2023, Health Workers Alliance for Palestine wrote an open letter, which was signed by over 3,700 health workers, and I think it'll be put to the chat, and please, if you're a health worker, sign it. It called for an immediate ceasefire, an end to the targeting of healthcare facilities and workers, an end to the siege of Gaza, and an end to the occupation of Palestine and the apartheid system. As mentioned earlier, many of the signatories were called in by their bosses or had official complaints made against them. In addition, as was covered in the CBC, someone made a list of 271 medical students who had signed the letter with the stated intention to share this list with program directors in advance of the CARMS match. The CARMS match is when medical students get paired to their residency, and tampering with this process could have very, very significant impacts for trainees. In response, HAP and many other organizations issued a joint statement on the targeting of medical learners, and you can take a look at our social media to read the statement and find out more. Now, on the one hand, we've seen this targeting of learners and health providers, while on the other hand, we have heard absolutely deafening silence from our medical associations, with not one single medical association calling for a ceasefire. At a time when so many have been killed, this is truly shameful and a manifestation of anti-Palestinian racism. Just this past Monday, I attended a rally in Toronto following the chilling news of the attacks on Rafah. This rally did not target any specific hospital. It went down, some major streets, including University Avenue in Toronto. You may have heard the speed with which politicians from all levels of governments denounced and completely misrepresented the events of that evening, a speed which we have not seen in calling for an end to the bombing of hospitals. All of this outrage, this misuse of accusations of anti-Semitism, is a distraction from where our eyes, our hearts, and our actions must be at this time, namely to continue to do everything we can for an immediate and permanent ceasefire and for free Palestine. I really want to say a few words to my colleagues in healthcare, which is that as Jewish people invested in the safety and well-being of our communities and in the dismantling of anti-Semitism that puts all of us at risk, we need to recognize that these anti-Semitism accusations that I've detailed and that other speakers have detailed make none of us safer, and instead feed into the tactics of divide and conquer used by white supremacists and obscure the real solidarity being displayed all over the world by thousands and thousands of Jews towards a free Palestine. I want to bring us back in closing to focus on Palestine and on the brave health workers who are working under relentless and genocidal aggression, and on all the hospitals which have been bombed, and yet still, wherever possible, with immense resilience, continue to offer whatever care is possible. I will end here by asking you to consider signing onto 2 open letters. The first is a statement against the adoption of the IRA working definition of anti-Semitism, specifically to health facilities and institutions. And the second is regarding access to care for people coming from Palestine and Sudan. Hopefully the links will be put into the chat. Just thank you so much. Please follow us on social media and happy to answer any questions. Thank you.